Welcome back to Goodrich Medicare Solutions. Today we're going to chat about the Medicare Advantage PPO plan. This is a fairly new concept that came into vogue a few years ago, and the reason for this is people were dissatisfied having an HMO plan with a primary care physician and having to wait for referrals. So companies came out with this idea that instead of having a Medicare supplement plan where you have this large premium and you do have choice of doctor, they came out with a hybrid where you have choice of doctor with a low or no premium program. And so let's get into some of the advantages to this, no pun intended. So the first advantage to having a Medicare Advantage PPO plan is, of course, choice of doctor. And I think we can agree that in most cases, having a choice of doctor could make the difference between life or death. So if you want to stay around a little longer, we might want to consider you having a choice of doctor. Second is no referral needed. Again, getting back to the concept of a gatekeeper with a primary care physician, with a PPO Advantage product, you can go to any specialist in the network. In addition to that, there's actually out-of-network benefits available to you as well. The caveat to this is you've got to make sure that the provider you want to see that's out-of-network is willing to bill the insurance company. And as long as they are, you're automatically going to be covered. Let's get into the cost, which we've touched a little bit upon already. So most of these Medicare Advantage PPO plans come with a low or no premium for the plan itself. Now, there is some copays that you may have for a doctor visit or for surgery or hospitalization. They're normally fairly nominal compared to the big scope of things when you're talking about $100,000 or $200,000 potential hospital bill, and you may have a copay of $250 or $350 a day for the first 5 days for the hospital, as an example. Doctor visit, you might have a $25 or $35 copay for that, and maybe some copays for some testings. And keep in mind, there is always going to be a max out-of-pocket incorporated in the plan. There's always going to be a max out-of-pocket incorporated in the plan. A max out-of-pocket is simply the max that you would pay in a worst-case scenario, meaning if the bills were $3 or $4 million, you would only pay, let's say, $6,500 max out-of-pocket. And of course, you would have to have quite a large bill and quite a number of expenses for this to occur. But they are built in the plan, so you have a safety net knowing that, again, if the costs are exorbitant and you're in the hospital for several weeks or a month, that you're not going to have to empty out your entire bank account. All right. There's some additional benefits that come with these Medicare PPO Advantage plans as well. Most of them will cover vision, dental, and hearing. Also, they're going to give you a built-in drug plan. So you have everything built into this plan that you need: doctor, hospital, emergency, and a drug plan, all for one low premium. So for people that want a little more flexibility or traveling from state to state or maybe county to county, and they just simply like the idea that they can go to the doctor of their choice and have a little or no premium payment every month, this might be a perfect fit for you. So it's something to think about. All right, that's a wrap. So if you have any questions, comments, feedback, let us know. We're here to help. All the services we provide for you are free of charge. And the reason that's so is because Medicare is largely supplemented by the federal government, and the federal government pays us indirectly, so you don't have to. All right? God bless. Thank you for watching. And the do right now is click the link below, subscribe to our channel, because it's the best thing this side of the Mississippi. All right. See you next time.